I think we're recording now, Miguel. This is Dr. Miguel Damas. This is Meet the Doctor. And this week we'll be discussing exercise and the importance of exercise and the protocol. Before we start, I need to read a little disclaimer. This interview is from our own personal experiences. We are not talking in specifics, but generalities, not referring to any individual particular cases. We are not giving medical advice. Medical protocols and methods of treating should be done with a licensed medical professional. Good morning.
Hi, John.
How are you?
Good evening.
Good. Yeah,
I'm very fine.
All right. As I said, we'll be talking about exercising. I didn't know myself until well after a year that I was supposed to be putting weight on my body. Yeah. Can you speak into that a little bit and share with us a little bit?
Yes, of course. And most patients on the protocol may have been told or may have read or may have been advised to do exercise to quote unquote prevent bone loss. So what we are discussing here in terms of exercise in the Quiver protocol is to maximize the bone density of the bones in order to prevent any potential downside effects or downstream effects of high vitamin D on the bones. So what seems to happen is when we are taking a lot of vitamin D, it seems that the renewal process, the bone turnover process, gets enhanced, it gets amplified. So this process means destruction of bone and construction of bone. However, in some people, the destruction part is more active than the construction part. And with this treatment that is very long-term, it may lead in the future to bone density loss. Now, from my experience with my patients, there seem to be key factors. They may put some patients in more risk of losing bone density. Women, low body weight, long-term take of drugs for the autoimmunity like cortisone and others, and inability to move. And this is the critical part of exercise, is that in order to make sure that our bones are as healthy as possible, we need to try to increase their bone density or prevent the bone density loss. And there are two main ways to do it through exercise. One is with aerobic exercise. So most patients may have been told to walk at least 30 minutes per day at a brisk pace. And that what will cause is an increased production or release of an hormone called calcitonin. And that hormone will fixate or improve the calcium in the bones and improve the bone density. So that's the reason why people should walk on the protocol at a fast pace, not run, but walk. The other way to do it is to put stress on the bones. And that is one of the key triggers to enhance bone density. So anything that will increase the pressure of the muscles into the bones or the vertical strength that is put on the bones will be helpful. So combining the two will have a very good ability to act on both systems and hopefully prevent any bone density loss. And maybe that also happens quite frequently, an increase in bone density with treatment. And we are talking here long-term picture. And that is the reason why everyone on the protocol should walk, should do some exercises and put pressure on the bones. So, however, we need to acknowledge that there are people that cannot do exercise. So there are a few tricks that anyone can do at home with or without machinery or gadgets. So, for instance, instead of walking, or the way I put it to my patients is it is much, the most important thing is to do something. Anything is better than nothing. So if you cannot walk 30 minutes at once, it's better to walk twice 15 minutes. If you cannot walk at a brisk pace, you should walk at your own pace. But put some exercise in, do something. Other tricks would be using those weights that you put on your wrists or your ankles, and you just go on with your normal life. Because without noticing, you'll put pressure on the bones, especially on your hips, on your arms, and on your spine. And you will notice at the end of the day how sore your muscles can get from doing this type of exercise without committing the time and the effort. Well, now I need to exercise, now I need to walk. So that is the two major tricks that or advice that I give my patients when it comes to exercise. Obviously, it is that there are machinery, and before I start recording, we were discussing the vibration plates, and yes, they are good. They seem to have a significant effect. They seem to have a good effect on bone density. As we were saying, NASA seems to use it with astronauts to prevent or reduce the bone density in the outer space as there is no gravity. But we also need to acknowledge that no one or not everyone will have access to a vibration plate. But if you can, just use it 5 to 10 minutes per day may be enough to get the positive effects that we are looking after. So at the end of the day, everyone should exercise as much as possible. We should not go overboard. We should not over-exercise. We should not over-stress about exercising. And that will tie back to the whole discussion we had on stress. But if you can, everyone should walk 30 minutes per day at a brisk pace, do some weight bearing, whether or not using the wrists, the weights on the wrist or proper weight lifting. And that is a very good thing you can do to enhance and improve the bone density of your muscles. And that's my advice to all my patients. Obviously, everyone is different. Please do not take this as medical advice or direct advice. But this is what I do with my patients.
I see. We get a lot of questions concerning vibration plates, and someone this week told me I just can't afford one, and I said, "Well, how much are you spending?" And he said $500, 500 American dollars. I said, "Listen, I was out there kind of beating the bushes for a little while, and I found a vibration plate, a whole machine, not just a plate. There's different styles, but I found a stand-up vibration machine for $35. So they're out there. You may have to shop around a little bit for them, but for myself, I was one of those people that you were talking about that, I couldn't walk up 30 minutes a day, but I really loved the vibration machine once I was able to get one and get on it, really. And so, but something I want to speak into there, I want to tell you at 55, things go away a lot faster than they do at 25. And he said the importance of doing something. I can speak into that. My father was walking 20 miles when he was 75 years old. I mean, the guy just never stopped. And you can't, when you stop, and like I said, the older you get, the quicker it sneaks up on you. But as long as I'm doing something, things come a lot easier, and you're able to maintain, but you got to stay on top of it.
Yep. better is something is way better than nothing. And we
Yes.
have a saying in Portugal that goes like, stopping is dying. So when you stop, you start to the process of dying. So the more you do, the more active you are, the more alive, and the better. That's for sure. That's for
Yes,
sure.
that's for sure. All right. Is that all that you have to say about exercise force?
Yes, I mean that is the pretty much the message
Yeah.
that I want to share on exercise. Do as much as possible without going overboard, in order to specifically in terms of bone density, to prevent uh, bone density loss or improve your bone density or bone health.
Well, I'm very happy that you spoke in that because, I mean, like I've said, and like I've said on here, I didn't know anything about, there's a lot of information out there about the protocol if you search for it. But there wasn't, when I started, there wasn't something just like click, you got to do 30 minutes a day. And, you just clicked on it and read on it. There was nothing like that out there. So if you're watching this and doing the protocol now, make sure you do something every day. One thing I wanted to talk to you about was we were talking about aerobic exercise. You can do aerobic exercises without them being a weight bearing exercise. So like I ride a bike, but I ride
Yeah.
for an hour a day. So, but I don't put weight on my bone. Is it important that we do a weight bearing exercise?
I mean, if you do weight bearing, you're just combining the two. So the aerobic exercise seems to be the key factor to increase that hormone lying around, and that will have an effect. But if you're the walking, for anyone that can do, is a good option because you are putting some pressure, not a lot of pressure. You're not risking that much. Most people don't run, or but everyone may be able to walk more easily. So, but if you can do on a stationary bike, or if you want to swim, that's all fine. That's all much better than nothing.
Right. I used to swim, and let me tell you, swimming is good for you. It's one of the few exercises you can do that works almost every muscle in your body.
Yeah, exactly.
So anyway, well, thanks, Miguel. I
Yeah, that's
enjoyed
my pleasure. See you next
enjoyed
time. Bye
talking to
bye.
you. All right.
Thank you.